You're going to find what you do best. For me, what launched me was doing informal marketing events, right? Sitting at a grocery store, at a Walmart. In Texas, it's H-E-B. And so we are sitting in those events and you see hundreds of people daily, right? And so people finally see you're like, oh, you're a trusted person. You're here every Tuesday, every Thursday. And then they finally stop and, just chat with you and get to know you. Wow. That's another way of doing it. But it's consistency. I didn't get it in the first day. It took several times before you earn people's, but being consistent. Agents, you need to be consistent with everything you do.
Ladies and gentlemen, welcome back to the Medicare Sales Playbook. I'm your host, Dallas Keithley. Man, it is a privilege and an honor to be on your airwaves. Nowadays, I don't know where podcasts go, but I'm glad you listen to us. However you're listening, whether it's YouTube, whatever it may be, we appreciate you listening in. And so we thank you very much. Keep sending comments, keep sharing, subscribing, liking, doing all the stuff that all the cool kids do. Today, we are joined by a very special guest. You had a little trouble getting here, so it's worth it. So right, it's the old Heinz 57 commercial. Good things come to those that wait.
Yes.
But we've got Christina Perez with us today.
Thank you.
So we talked about this before, right? And she's like, Dallas, I can't say it the way you say it because, then it just sounds wrong. And I'm like, well, do I try to say it out? I'm just going to call you Christina from here on out.
That works.
Yes, ma'am. Well, we appreciate you coming in.
Thank you.
Much.
Thank you for having me.
Absolutely. So when it comes to Christina Perez and Perez Financial Group, man, you guys have built something special. And so talk to us about what you have, where you are. We're gonna teach people how to do what you do. But first of all, I want to lay out the groundwork of what is it that you do, who are you, and what do you do?
Sure. I'm Christina Perez, and I'm from South Texas. I've been in business in the healthcare and Medicare and life, mostly Medicare and ACA for the last 17 years. Well, Medicare for 17 years, ACA like the last 8. And I just help agents. I started with just helping myself, right? Be self-employed. And over time, people they see your success and they just need your help. Yeah. So now I just help agents, do whatever. If they want to do what I'm doing, I just lay the groundwork. I work with them. I mentor them. I help them answer their questions and get them where they want to be, not what I want to be. Because I used to think they want to do exactly what I want, but it's not. It's, I always said, I would tell people, hey, you should do, my goal was 100,000. Everybody should make 100,000. And then I realized over time, it's not what I want. It's what you want. Maybe you only want 50,000.
Right.
And that's okay too. So you just have to meet people where they're at. But you have to ask good questions.
Yeah.
You need to ask them. I used to assume they wanted to make 100,000.
Right. Okay. I want to dive right in there because what we want to do today is we want to take people. Before the show, I was asking Christina, so we were saying, what do we talk about? I said, well, what if we had a new agent? And they said, Christina, I want you to take me from I don't have my license to I'm building what you're building currently. So that's what we kind of want to do today. But this is really good. I want to park here for just a sec because you said a couple things. You said it has to be what they want.
Yes. It
because
has to be.
If it's just what you want, they're not going to work for it. You will. You'll drag them, I almost said down the aisle, but whatever.
I will.
You'll drag them kicking and screaming, and it's miserable. And both of you hate each other, and you're like, well, I just want to see them succeed. And they're like, why won't she leave me alone, right?
Yes.
So talk more about why is it has to be their dream, and how you said questions. What are some of the questions that you ask to get them to realize, okay, this is my dream?
Well, I just had a conversation I was telling you earlier today with an agent that wants to join my team. And, so many people say that. They see him on a podcast, something like this. And, and then I just started asking better questions, right? I do that even with my clients, and I just have to do that with agents now. It's like, what do you really want? What is it? One of the questions I said, what is it that I can do that can make you successful? Right? Ooh. Right? Because you want to join my team. You have another upline, or maybe you don't have any guidance, but what is it that you see in me that you think with my help I can help you? Because what I don't want is I don't want to repeat that you just switch over to me and then you're still disappointed. Yeah. We didn't ask all the right questions, right? Like where is it that we can align? I want to make sure that I'm aligning with people that want the same thing I do.
Yeah, I love asking people the question because we get it too. People are like, I want to come join y'all. I want to come be with you. And I'm like, okay, but hold on. I think the insanity definition is do the same thing over and over and expect something different. So I like to ask them, Dallas, answer this question for me. Dallas, if I had this, man, I know I'd go to the next level. What is that? What is the this, right?
Yeah, that's a good question. What is the this? I think it's a discipline.
Yeah.
The drive to, like I'm going to eat ramens if it takes for me to stay, self-employed, and freedom.
Yeah.
Because that's what it took for me. I remember I didn't know what the heck I was doing because I didn't have a big mentor. I had an upline and everything, but my upline wasn't as organized as they are today, right?
Yeah.
So we were always misaligned because of, and I would say because I wasn't 100% committed at the time, years ago, right?
Yeah.
I was working full time and doing this like on a Friday evening that I get a call, right? And they already done with their day.
Yeah.
Right. So I was constantly missing the people that could help me. They weren't available when I was available. But I knew one thing. I didn't know I was going to figure it out, but I knew one thing. I really loved my freedom. Yeah. And I'm like, man, I can get to do all the personal stuff I want to do. For me at the time, I've talked about this in the past, I wanted to go Wednesday church on Wednesdays because I was always working evenings, working retail. I wanted to have my weekends to myself. I wanted to have a license that I didn't renew with a uniform name on it, right? Like things like that you do that you have to do when you're working for someone else. So I got a taste of freedom. I just didn't have any money.
Yeah. Which
I know.
Those one really needs the other.
Yeah.
You can have freedom, but
and I really just knew, okay, I'm like, how do I stay in this business? I really like the business, but I don't know how to get clients.
Right.
I remember going through that and feeling I was paycheck to paycheck, literally shuffling money. As soon as I'd get it, I'd pay the rent. I paid the rent.
Yeah, you're waiting until the bills are pink because that's when they're really serious. And so that one can, but this one can.
And I just did not know how to get clients, right, at the time because I'm thinking like I'm an employee, like they just come to me.
Yeah.
And then I could do the rest. So I had to switch it. That's the big thing. So you have to, as a new agent, you have to figure out what are you willing to do to make this work. And then are you, if I think about it now, if I would have had someone like me back then that was available to answer all my questions, that was successful to kind of hurry along, I had to beg God to help me.
Yeah.
I literally was a desperate prayer. And then he sent me the right people and I was just open. I was just open to like, I will do whatever you say. Just help me.
Just help me. And you're singing my song because same thing. I would go to work, but I don't know what to do because all my life I've clocked in. Like somebody told me, you be here at this time. You put the time clock in the clock there. Then you go here.
Yes.
I'll give you a list of things to do.
Yes.
Then you go do them. Then I'll tell you when to go to lunch. Then you come back and I'll give you another list. You do those things and I'll tell you when to go home.
Yes.
Like you don't realize how much your day is controlled until you get out and you're like, okay, crap. Do I eat today? Like what's, And so, till you develop that system of this is what my day looks like, day to day, hour to hour, all that, it's so tough to succeed in this business.
Yeah, it is. Getting structure. The other thing I notice about new agents is that besides not knowing what they're doing their day to day, because they don't have clients to be servicing.
Right.
They don't understand. They think it's like, oh, I'm off, but you don't understand. We don't get paid.
Yeah.
We don't get paid. So
I love seeing it's almost Friday in insurance chat. I'm like, what the freaks it matter what day it is?
Yes,
like the clock doesn't stop.
I know. I forget what day. Oh, there's a holiday coming.
Yeah.
It's only because it's Christmas.
Matter.
I'm like, oh, that's right. We're supposed to be off. Yeah. Right. But you cannot think like an employee.
Right.
You need to think like the boss.
Like a business owner.
Yes. And you wear every hat. Every hat. Marketer, enroller, cleaner. You're at service to your clients. Yeah. Humble yourself. Be a student.
That's good.
Right? You have to be humble and be a student. It doesn't matter how, and I think something I was just talking to my brother Lupe about, I said, you know what, something that I hear common with new agents, these guys are all business professionals. I've got principals, real estate agents, like they did this other thing for a living, right? And they were great at that. And it's a different thing they're doing now. And they don't like being students. Right?
Yeah. Because there is, I was talking to my daughter about this. She's a barista and she's getting in the insurance world. And she's like, Dad, you know what I like about my job now? I go in, she's like, Dad, I'm a great barista and it's easy. I know exactly what does, this does, that does, this does. She goes, I walk in the insurance office and I'm like, I don't know
a little lost. You can feel a little lost and
Yeah.
discouraged.
Yeah.
And then all this stuff is a little complicated. Insurance is a language, right?
It is, yeah.
It's kind of like you trying to speak Spanish.
Yeah,
You're like,
yeah.
I talked to you earlier about, I said a little phrase for you. You're like, wait, slow it down. Like, what?
Yeah.
Right. And
I
so
thought we were fighting for a second. I had no idea what was going on.
yes. And so I have to constantly explain to people like, hey, you're smart. You got your license. You can do this. The thing is, you have to put on a student. You have to be coachable and you have to be a student. And Tony Robbins once said this. He's like, he was invited. It's a story that stays with me because when I go to conferences, I have to put on it doesn't matter. I've been in this for 7 years. I have to put on a student, hat and then be open. And he was talking about that. He says that some guy, he was very famous already, Tony Robbins, and then he was told, he was invited as a guest, and he goes, I sat right in the front, and I took notes like no other. And he's like, I'm going to take something out of it. I have to stop thinking of who I am, all the things I do know, and just be open to learn.
Isn't that crazy? And we just heard him speak here recently, and the dude said he read, 700 books between the age of 13 and 18 or something like that.
Something crazy.
And
he's a speed reader.
Could you imagine presenting and Tony Robbins is sitting in the front row, like, feed me? And I'd be like,
yes.
Insurance starts with an I, and, that'd be tough.
Yeah. So I've learned that. New agents need to be, you just got to be coachable and be a student, learn. You don't try to figure it out on your own. You've got a team behind you if you find a team. Right?
Yeah, I like it.
Learn from and attach yourself to the best in the group.
Yeah.
Don't go for the people that are barely making it. Who's going to tell? That doesn't challenge you.
Yeah.
Sit next, talk to the person that's most successful. That person is going to give you nuggets and it's going to make you better. It's proven.
Yeah.
It's proven.
100%. So I want to start there. So you say, I've got a new agent sitting right in front of me. You're telling them be a student. Let's dive more into more practical, like Medicare. You talked about the ABCs of Medicare. If you don't get A and B, you can't sell C and D.
Yep.
How would you relay that to? So you're talking to a new agent. They've got to learn it. Where would you tell them to start? What do we start with?
Well, I sit my agents down and I teach them the ABCD. Like my simple version. I mean, I can give you a Medicare and You book. That's a start.
Yeah.
That thing's like still Chinese.
Yeah.
Right? Until you become a seasoned agent, all of that makes sense. But in the beginning, I read that book and I'm like, what is this?
Yeah.
Like I didn't get it. Right? So I had to simplify that book in 5 minutes so that I can regurgitate that to my clients.
Nice.
Right? So you make it simple. Once I did that, once I started to break down the ABCD, because I used to go in straight into open my book, my carrier book, and then and explain everything, I wouldn't close. I started asking better questions. I'm like, okay. And and what I mean by better questions, I asked my client, I started getting like courage and I'm like, why aren't you taking this? This is better than, why do you want to stay on Medicare? And then I started to learn, they're like, well, because Medicare doesn't charge me all these things. And I'm like, what? And that's when I realized, oh my goodness, you don't even know what Medicare charges you.
Yeah.
So then that's when I realized, I need to teach you A and B so that you can understand where C is going to be better, or Medicare supplement's going to help you, and then where does D come in, and where does all the extra goodies come in? Because they think Medicare's Medicaid.
Yeah. Or it's just, I'm going to grow up, I'm going to retire, I'm going to get Medicare, and
everything's going to be covered.
I'm fine. Yeah.
No.
Yeah.
No.
So and one thing you said there too, in order to be able to teach something, you have to be able to understand everything about that something. Like, yes, you're putting it out in 5 minutes. Here's this, but you're able to do that because you have a full understanding of the whole process, right?
Yes.
So you you really, like you said, be a student. When it comes to, so I'm talking to a new agent, how do you gauge if they are sitting in front of a client, how do they gauge how much a client already knows? Or like, where do I start? Do I need to start like, okay, this is
I never
Medicare.
assume the client knows.
Yeah.
I never assume. I mean, I will ask questions, right? You've got to ask questions. Like, how much do you know about Medicare? Are you familiar with, like, get out your card. Let me show you a little bit about what the government just gave you.
Right.
And let's go over and I always tell clients, I don't know if anybody's ever done this with you. If you're new to Medicare, you haven't even looked at your Medicare book because you haven't even received it.
Right.
Okay. And it's whatever they can Google. But like I said, it's still kind of Chinese. It's not very clear, but I'll just say, you've probably done some of your research, or maybe you haven't, but just for peace of mind, let's go over the basics.
Let's start at zero. Yeah.
Don't assume, just let's go over. I want to make sure that this is a good quality visit.
Yeah. Okay. So just assume, start at zero. I always tell clients too, I need you to do away with everything you think you know, right? Because you've heard from your aunt. I love walking in there like, I want the Humana Gold Plus plan. And I'm like,
it happens to me very early.
Yeah, any more, but you
but
get
you do have those people that are like, no, this is what I want.
My neighbor's got the Humana Gold Plus. They said it's the best. I want that plan.
Yeah.
And nothing against Humana Gold Plus, right? But I'll sit there and I'll say, okay,
whatever. Yes.
Look, if you want that one, but you understand that ABC plan is going to cost you $1,800 more a year in drugs. Well, okay, let's talk about the others.
Yeah.
So just tell them, let's throw everything out. Let's start from zero and just let's build a platform and build.
Yeah, but even before you start talking business, like build a rapport, talk a little bit about yourself. Like I have an ex-principal that just joined the team about 6 months ago, and she retired and she was ready for something else. And I was just so happened to be the agent to her friends, and she's not a Medicare age yet, but she's just like, so that's how she got on my team. And the whole, and I told her, use that. You know how respectable your position is?
Yeah.
Like, yeah, you're retired, you no longer do that. But people can admire, there's trust behind that. You run a school for how many years? Talk a little bit about yourself, break the ice, show them that you're a real person, a human being. My brother has a love for plants, right? And my brother goes, when he does home visits, if he sees plants, he was always talking about, hey, who's the green thumb here in the house? I mean, your plants look amazing. Find some common ground with people.
Yes.
Yeah. Become a real person, right? Like there's things I like. If there's, like I said, my brother found plants. I'm trying to think. I haven't done a home visit, but I will always ask just things to get to know the client so I can get a better gauge of who are you? What's your background? Ask away. I'm an open book, right? I'll tell them things like, like I have a picture of my dog on my phone. I would sometimes take my dog to the office. I want people to feel comfortable and just ask me anything. I'm like, yes, I'm a salesperson. Yes, I'm an insurance agent, but I'm a real person. I have grandparents. I have a mom that I put on Medicare. My dad's on Medicare. I mean, to me, it's like, no, I want to make sure everybody's taken care of.
Yeah. I love that. And people buy, for some reason, it's like we look for commonality even. I travel a ton, and if I see somebody that's got the same sports team on that I like, all of a sudden they're my friend.
Yes.
And that guy could be a serial killer. I have no idea, but hey, go Cowboys, right?
Yeah,
But
exactly.
it's just there's something about that commonality that we love.
Yeah, I made a friend at Luby's, right? Do you ever go to Luby's?
Do I ever go to Luby's? Listen, my wife is in the other room.
Yeah.
I asked my father-in-law if I could marry my wife at a Luby's.
No, I'm going to tell you no.
No, that was his decision. No. I asked him if it was okay. I asked permission.
I'm like, I'm telling you no.
Yeah.
You better take her to Mexico or somewhere beautiful.
No, he and I were at a Luby's.
Oh, gotcha.
And so I asked him there. Okay. And so I've never been back. No,
you've never been back.
No. We don't have Luby's here.
You wanted to go marry your wife at a Luby's?
No. We didn't get married at a Luby's. I asked for her hand at a Luby's.
Oh, that's sweet. That's sweet. Yeah. Well, at Luby's, I recently was waiting for my takeout, food, right? And I saw this lady, and she had a picture of a Yorkie on her phone. I'm like, ooh, that's a really cute dog. Is that your dog? And I just sparked up an interest. I'm like, look at mine. And because, and then we just hit it off. And then.
Isn't that crazy?
Yes. And then we just started, what do you do? I'm an insurance agent. I do the indirectly. I wasn't there. I was literally, it's because she's got a dog and I love dogs.
Right.
And we became Facebook friends. Yeah. And exchanged things. And I'm like, eventually she's going to be my client. You wait and see.
Yeah. And if my wife would ever get her insurance license, I'm looking at her now, she would be a trillionaire because every person, like I get on a plane and I put the AirPods in, like I give all the signs as hard as I can, like I don't want to talk, right? She gets on a plane and I always laugh because by the time we get off the plane, she'll be in the middle, there's somebody over here. They're going to have laughed together, cried together, probably prayed together.
Yeah, I don't know.
And I get off the plane, we're driving home. She's like, "Oh, I hope Mary's okay." I'm like, "Who's Mary?" But yes, it is that.
She just earned a whole new friend.
Exactly. Yeah. And I'm like, "Did you sell her any insurance?" But she said, no. So okay, we've got the learning down. One last thing I would add that popped into my head here is also when you learn, you also learn to find opportunities,
yes.
right? Like, so if I know all of my plans, and I know which hospitals go with each plan and doctors and all that. And if I'm talking to someone and they're like, yeah, I'm on this plan and I'm on this hospital network, if I know, hey, they're dropping them or they did drop them or something like that, if I'm a student of the game, I recognize an opportunity.
Correct.
And I can pounce on that opportunity rather than just like, well, it looks like you're good here.
So that's something I do see in new agents, that they're a little bit lazy.
Yeah.
And they think they can do shortcuts.
Yeah.
Right? I'm like, you need to read your books. You need to really, like, every single one. You need to know what's out of that book. Get to know your plans really well. And maybe you can't remember all of them, but start with one company, master it, right? And then move on to the next and so forth. That's the part that you're still a student.
Yeah, and it'll come. I always tell people, my parents we moved to Papua New Guinea when I was 9, I think it was, 1990. And man, we listened to all these tapes to learn. In New Guinea, they speak Pidgin, right? Which is the most useless language in the world. It couldn't have been Spanish, right? But we go and we land and we think we know the language. Like a new agent, man, you walk in there, first house, and we get off the plane and they're talking and I'm like, did our plane take a wrong turn? Because this is not anything like anything we know. But after being there 2 weeks, man, we're fluent, because you're in it. And you're learning as you go. Immersed, exactly. Good job. Okay, so then you said the basics. Now, we already mentioned it a little bit. The hardest part of insurance is not studying. It is not selling even. It is having someone in front of you to sell to.
Yeah.
So I asked you, find the client.
Yes.
I asked you if you had no money, because that seems to be a commonality between young insurance agents. You have no money. What would you do? What would you tell an agent? Here's where you start to find people.
You need to go find events, community events, things with high traffic, right? You don't need something that only 10 people pass by. So find an event in the community, not just one. Like, you should be busy 5 days out of the week. Go find places where you've got lots of foot traffic. Think of food banks. Think of bingo halls. Think of health fairs. Anything like that. Partner up. You could sit at a doctor's office if you can build that rapport and get in there. Anything that has high foot traffic, you want to be 5 days out of the week, your business is going to go. Okay.
So let's say I see a food bank, right? So what I would do, and I'm going to tell myself, is I would already start to build, here's why this won't work, right? Like in my head.
Yeah.
Like, I'm going to go up and talk to this guy. First of all, I'm never going to meet the director of the food bank. There's a gatekeeper. I'm never going to get past the gatekeeper. Sure. 2, why would they want my help? I'm sure they have 50,000 insurance agents come in and want to help and do all this stuff or want to do it. Right?
It's not like that.
Yeah. So tell me, how do I get over that? And then 2, how do I get myself in the food bank?
First and foremost, any event, whether it's a food bank or anywhere you've got to go, you want to go and go introduce yourself, right? One is you got to stop caring get out of your head.
Yeah.
Right? Remember that what you do brings value, right? So you have to understand what we do brings a lot of value. They don't know. And so you're probably going to get a few no's or like, sure, I'll take your card. But that sells too. It's a numbers game. It's okay. With every approach, you get better with what you say. Right. Practicing what you say. I've had people tell me, I've walked into doctors, dentist offices, right? Because I'll go collaborate with them too. And they're like, oh, okay, sure. And then like 3 dentists later, oh my God, I've been looking for someone like you. So, you just have to, one is get your thoughts together, understand your value, know what you're going to say, and know that it's not always going to be like, sure, here's the, open door. Yes, come on in.
Here's our client list.
But you'd be surprised. Yeah. There are a lot of people, they just don't know what you do. And I would set up something like, can I sit down and take you to lunch? Take your staff out to lunch? Can I do a lunch and learn? People love to eat, especially on their, on your, it's not their dime. So offer something. Can I bring some, Starbucks for everybody and just kind of give me 10, 15 minutes of your time? I'd like to share a little bit of what I do with my, for a living and how I help people, seniors in the community. There's a lot of fraud. There's a lot of things going on that, that they're not aware of. This is my card. I'd love to help and be part of helping you guys. Also offer to volunteer, right? If you volunteer for places, your time, it allows them to get to know you as a person and realize that, oh, you're a real person. Now I have a relationship with you. Now, yes, come and set up. Yeah. So give of yourself up so they can help you.
And you're not just there for a sale.
Correct.
Right? Like I learned that from a good buddy of mine, does real well in all the different stuff. Well, Gabe Tovar, you know Gabe. And he always said, look, man, we turned around our networking opportunities when we realized that go to them, find their pain point and see if I can fix it.
Yes.
Like go up and ask, hey, do you hate Medicare billing questions? You can send those all to me. Send every one of them to me, and I'll just...
Yeah, so I have a story about that
to
share with you. So I go to Bible studies with my church group, right? And I've been through many, and in those, you've got people from the community. And we were praying over this one sister of ours that she's a medical biller, and she was looking for a job, and it was her and her friend. I guess they had just moved down here, and so we were all praying for her, whatnot, and then she comes back and tells me she has a praise report. She's like, I got a job, right? And we're like, hey, that's fantastic. And then I set her aside and I say, hey, I don't know if you know what I do. And I just want you to know, I'm an insurance agent. I focus mostly on Medicare. And at the time, it was kind of still, ACA was still new. And I said, but healthcare in general, I said, if you need to shine, so you do this on your side, you're a biller, right? But then you don't know the other side. And I said, but if you need to shine, you have any problems, please come to me. I'd love to be a resource so that you can be better for your boss and they can appreciate the value that you bring to them since you just got this job.
Wow.
Right? And so she's like, yes, okay, but remember, I built a friendship there, a trust there first, right? I didn't go to her like, oh, she's a medical biller. Let me get in, from the start. Like, no. And then from there, it started. She calls me one day randomly and like, hey, my boss needs healthcare for his family. Can you come to the office? Absolutely, I'm going to go to the office. Yeah. Go meet the doctor, take care of him. He was a toughie, he's like, again, they don't always like us, right? Because they don't understand us.
Well, and if they have 9 problems or if they have 10 problems, 9 of them are insurance. Right?
Correct. Yeah. And I'm part of that.
You're associated.
Even though I'm not the biller, right? And so from there, it took me a little bit, about a year to earn his trust. He'd call me all the time for everything about his healthcare. And I'd be there servicing him, right? And then finally, his manager's like, hey, by the way, the doc says that we could give you all his clients now.
Wow.
Yeah. But it took time. Yes, I had to earn that
trust. Yeah.
I had to earn his respect and see that I'm not fake. I'm not just here. I would service anything he'd have a problem with. I'm like, I'm here to truly help you. And then I would see my friend. I'm like, high five. Right. And then,
That's awesome.
7, 8 years now, I'm still service his practice. And he gives my card out. You need to call this young lady. She's going to help you. Yeah. And he sends me not just enrollments. He sends me problems, and I said, I don't care what it is. Send them to me. I'll take them and send them right back to you.
Yeah, that's, we did a show here a while back called Centers of Influence. That is a center, man. Like, and those, yes, you can have referral partners. That's one level. But a center of influence is almost working for you.
Yes.
He's not saying, hey, if you have any problems, call her. He's saying, listen, when you leave here, this is next step.
Yeah, and you've got to try different things. Like, it's not just all doctors. Like, you've got to do sales events. You've got to do marketing events. You've got to do formal events. You've got to try a little bit of everything. You're going to find what you do best. For me, what launched me was doing informal marketing events, right? Sitting at a grocery store, at a Walmart. In Texas, it's H-E-B. And
I called it HEB last time I was down there.
Everybody knows it by HEB
what
too.
What is HEB? I'm like, H-E-B.
H-E-B. And so we are sitting in those events and you see hundreds of people daily, right? And so people finally see you're like, oh, you're a trusted person. You're here every Tuesday, every Thursday. And then they finally stop and, just chat with you and get to know you. Wow. That's another way of doing it. But it's consistency. I didn't get it in the first day. It took several times before you earn people's, but being consistent. Agents, you need to be consistent with everything you do. Yeah. It's not, just because nothing came out of one day, it's not a failure.
Right.
You should be passing out those cards like water. Free water.
Yeah, man. Good stuff. We could do about 5 podcasts. I keep thinking, okay, let's run this way. Right? Okay, so we've got them in. They're doing the grassroots. They're doing all this stuff. Now, let's say I've got about 50 to 100 clients on the books. Now I'm not somebody that's hoping they'll survive, right? Like now I'm eating the nice ramen, the spicy shrimp, not just the chicken and the beef. Like
we might even we could order from a restaurant.
Not just drive by and hope the Krispy Kreme light's on. Now I'm starting to build a business, right? You said something a while ago. What's the first thing I should do?
You need to get a CRM.
Okay.
At 50. I used to say at 100, But now with so much experience, I'm like, I've got agents calling me like, Christina, I should have listened to you. I should have done it at 50. And I'm like, as soon as you can afford it, and don't make it a decision because you need to manage yourself. You need systems. At 50 you should be having pretty decent money. You can afford a CRM.
Yeah. Mm-hmm. What am I looking for? Real brief, because we could, again, go down a very boring trail, but what am I looking for in a CRM?
Something that can manage different things, life, health, multiple lines of business that you're doing. Something that do things like marketing for you, like text messaging, emailing, besides just storing information, right? Mm-hmm. The basics of it's supposed to do. But things that can also help you just, instead of you calling clients, it emails, it text messages, worked for you.
Nice. Letting you do more of that revenue generating activity.
Yes. Technology, leverage technology to do more for you, touches for your clients.
Yeah. Okay. So now, I'm getting up there, 175, 200 clients. It's starting to click. Maybe I go get a new car, right?
No. Stop spending your money. So besides...
I was trying to throw you a softball there, man. You just cranked it.
No, because again, right, you're just barely building momentum. You need to be spending, you need to be saving money and putting money back into your business, into things that are going to bring you more business. The car's going to come, believe me. I think I paid off one car and then I bought another car, and I wouldn't even get into a luxury car. I didn't get into a luxury car till about 10 years into the business.
Wow.
Yeah. I had Hyundai forever, gas efficient. I didn't have an office for a long time. Kept my overhead as small as possible. I invested in an assistant.
Okay.
You're gonna need to get good people to help you. You're gonna need an assistant to do all the grunt work. You're out there grinding, getting new clients. You should be doing what you do best, right? Selling, enrolling. But you need someone on the back end doing all your paperwork, putting everything into your CRM, sending out those messages, reminders. Your appointment's on this day. Need to move this. You shouldn't be doing that. Someone's supposed to be your right hand.
Right. Garth Brooks does not go out and make sure the speakers are plugged in and the.
So wait on the car, invest in the assistant. Buy the assistant.
Buy the assistant. Okay.
Yes.
So you're building an internal team first.
Yes.
Right?
Yes.
You kind of building it
Infrastructure,
up.
yes.
Infrastructure, making that solid. Getting assistants. Man, I worked with Brian Askins for a long time. And that is one thing I've always loved about him. Brian is able to see the opportunity for growth, hire, and then grow.
Okay.
Most people grow. Everybody's complaining. Everybody's dying. We're working weekends, and okay, let's hire somebody. Let's hire and then expect the growth.
Yeah,
it's hard.
It is hard because you're afraid. The reason why people don't scale in staff is because can I afford it? That's always it.
Right. Yep.
I did it. I felt like can I afford it? And so I went, let me go part time, and that's how I started. Let me do part time. And then the other reason why you don't scale people is because you don't even know. Well, what about payroll? How do I do that? I mean, you don't know any of that.
Yeah, it's a business.
Yes, you don't even know how to do that, and so you're like, well, what am I supposed to just pay cash, or how do I do taxes? So then what do? You just don't do it.
Yeah, it's too scary.
You tell your wife or your aunt or your cousin or someone to help you, right? And you pay them cash as a little part-time help.
Yeah,
but that's not gonna. No. I mean, it's okay if you're doing that because I did it.
Right. Yeah. Right? Oh, we all have. Yeah.
Until I started finding people to help me do it right. And so you need this as I went from part-time to full-time. Immediately, I was like, oh no, I need a full-time. You realize yes, you do need it. You can afford it.
Yeah. And I think a big M word that you said earlier is almost, you have to have a great mentor. When it's time to switch from that business employee to the business owner, that mentor has got to be there. Find somebody that does, nowadays, there's so much information. I can literally learn how to do anything on my phone.
Yeah.
But find somebody that's been there, say, what is this, and this? Okay, so now I've got my internal structure built up. I've got my system. I've got everything going on. Now I'm ready to start building a team, right? What are some do's and don'ts? I'm talking about agents underneath me and stuff like that.
So there's two ways to get agents, right? We know we can get LOAs, and then we can get independent agents.
Let's back up. What is an LOA? What do you mean by LOA?
So LOA is a licensed only agent. That's more like an employee that works under you, gets paid payroll, benefits, and they get to enroll. And you can design that however you want. In my case, my LOA is basically I'm out of the office, and she takes over. Well, she's taken over 90% of my enrollments. I do I'm trying to get to 5%. But I still, because I have 2 locations, so that's why I do a little bit. But I basically handed her over all my Medicare clients to maintain them, to protect my book of business. And then I give her a piece of the pie because she is an enroller. But she's not going to look for sales opportunities. I do all that. I've done that. I've built that. So they're enrollers, basically. Someone that's not interested in being self-employed, being a business owner. They don't want all those headaches. They want to punch in, out, be successful, make good money, and be part of a team.
Okay.
That's in my case. There's always different formats of LOAs. You can explore that however you want. And then there's the independent route, which is where I started, where it's a bunch of agents. Like we're all, and they just like, hey, I want to work with you because you're doing it good. I want to work with you. Show me how to do it. Right. And then they're not your employees. These are other business owners that you mentor. That's it. We just mentor them. It's up to them what they do. Their success or failure all falls on them. But if they just listen, like to someone that's successful. For example, if you want to achieve what I'm doing, I'm going to tell you, I'm an open book. I'll tell you exactly how I did it. Now it's up to you, whatever you decide to do.
Wow. I love that. And here's what I really like, and we've got to wrap it up. I've got a sign up there telling me so. See how she talks to me.
Oh, I like it. Yeah. Wrap it up.
Wrap it up. What I like is one, how many, can I ask how many agents do you have working?
Yeah,
with
roughly
Perez
60.
Financial?
About
60 agents. Okay. How long in the business?
17 years.
17 years in the business, 60 agents.
Yes.
Right? Thousands of Medicare clients. Why are you, we're filming in Springfield, Missouri today. Why are you in Springfield, Missouri today?
Because I'm here to learn and still grow. I'm coming to a class to have better public speaking and communication blueprint.
But okay, let me play devil's advocate. Why? Christina, you're doing fine. Right? I'm assuming.
I am.
I don't, there's no drug habits or anything that I know of, right?
No.
You're doing fine.
Thank you. Yes.
Right?
Yes, I am.
Why? Why not just now sit back, take it easy, let the business grow?
Yeah, I know what you mean. No ways, because that's just boring.
Yeah.
Because I still have to grow in other areas that I'm not the best at. So yes, I'm comfortable speaking, having these conversations. But there's still areas I still need to get better at. And so I'm a student. I'm always going to be a student.
That's where I wanted you to go. Come on. Yes.
Student.
That's what I was looking for. I love that a lot of people are like, okay, once I get here, then I can stop being a student.
Never.
Once I get here, I can stop this. Don't stop doing the things that made you successful. Maybe you pivot a little bit and
Maybe
now
you don't
you're
have to
more
work
here.
weekends.
Yeah, exactly. Or you're driving a luxury car now or whatever it may be.
Yeah.
But it's don't leave what made you a success, right? Man, great stuff. Okay, so I'm going to do this. Are you still looking for agents?
Always. I'm always looking for agents.
Okay. Describe, you may be talking to somebody out there.
Okay.
You're in South Texas.
Yeah, South Texas.
If you are looking for an agent, you are at the point now where you don't have to, like some agencies, can you fog the mirror, right? You're looking for specific people. What are you looking for? I'm
looking for full-time people that are driven. I want people that are hungry because sometimes you get people that say they're hungry, but then they never show up to anything. So committed, driven people, you want to make a change. You're tired of your life. You're tired of the way that things are going. You don't like what you're doing. I'm like, if you're going to work hard for yourself. So that's what I'm looking for. People that they want to work.
I love it. Nice. So how can people, what's the best way to get a hold of Christina?
Get a hold of me. Call me. 956-540-7521 at my office.
She hasn't even given me that number yet, so y'all feel pretty nice.
Get a hold of me through email, Christina, Christina, at perezfinancialgrp.com. Shoot me an email. Look at me on Facebook.
Yeah, she's not hard to find.
Nope.
Yeah, pickleball court, whatever. She's there. We got a story. We'll keep that here. All right. Christina, thank you very much for coming in. This has been great.
Thank you.
And I think, listen, if people will listen and apply, we just helped some people today.
Yeah.
I mean, really. And I promise you guys, even if you're not going to be on Christina's team or whatever, if you send her an email and say, hey, would you help me on this, this, and this? I know her well enough. She's going to be like, yes.
Absolutely.
Yeah.
I'm always here to help someone. That's how I got started. Someone helped me.
Exactly.
So we have to help others.
Rising tides raise all ships, man. Yeah, we're helping other people. All right. Well, thank you, Christina. I appreciate it, man. Guys, thank you again for tuning into the Medicare Sales Playbook. I do hope this has been very helpful. I will say this, though. Our part is done. Like, we're going to go get some top shelf ramen. Your part now is to go and take it and apply it. If you don't apply it, you just wasted however long we've been talking. You might as well have been listening to whatever. Go out, apply it. Let me know how it works. We want to hear from you. That's what keeps us going, is when you reach out and say, Dallas, I tried this and this and this, and now I've got a relationship with a doctor and I'm in there 3 days a week writing clients. That's what we want to hear about. Do me a favor, like, share, subscribe, all that stuff. Thank you, Christina. Great job. And this has been well worth the wait. We will see you guys next time on the Medicare Sales Playbook.